Hi, I'm Dr. Junyoung Park from The Plan Plastic Surgery, a surgeon who truly specialized in and is passionate about facelift surgery. Recently, facelift techniques have largely been categorized into two main approaches. One is dual plane technique and the other is a deep plane technique. In Korea, these two methods are still performed at fairly similar rates. In my own practice, however, I used to perform surgeries close to the dual plane approach. But over time, I came to realize that the dual plane technique offers a very few advantages compared to the deep plane approach. For that reason, I now apply deep plane-based techniques to almost all of my patients. After seeing consistently better outcomes, I can confidently say that I'm unlikely to return to performing a dual plane facelift again. My confidence in this technique has continued to grow. Today, I would like to explain in detail why I transitioned from the dual plane method to the deep plane approach. So, what led me to this decision? One fundamental principle that both surgeons and patients generally understand is this. To achieve a safe facelift with long-lasting results, the smooth layer must be properly addressed. In that sense, both the dual plane and deep plane techniques follow this principle. But the key difference lies in how the smooth is handled, which is what ultimately distinguishes the two approaches. In dual plane technique, the skin is first elevated with a thin layer of subcutaneous fat is attached. After that, the smooth layer is dissected separately and lifted in different directions. But in contrast, the deep plane technique involves the dissecting the smooth and the overlying tissues together as a single unit, then lifting the en bloc. To better illustrate this difference, I would like to show actual surgical footage from procedures I have personally performed. First, if you look at the footage from past dual plane surgery, you can see that the smooth layer and the subcutaneous layer are dissected separately. The area you see here is smooth and this area is the subcutaneous layer. This particular case uses a high smooth approach above the cheekbone, and since the smooth incision extends down to the neck, it would be classified as an extended type. Now let's take a look at the more recent footage using the deep plane technique. In this approach, the smooth and the overlying tissues are kept together. Dissection is performed only to the extent necessary to create a smooth cuff that can be sutured. The remaining dissection process beneath the smooth, allowing the smooth and subcutaneous tissue and the skin is lifted and secured as a single unit. Because the smooth remains structurally intact, this allows the facial tissues to be fixed more firmly as a cohesive mass, resulting in a stronger and more stable lift compared to the dual plane approach. One common cited advantage of the dual plane technique is that the smooth and the skin is to be moved independently, which some believe that it makes easier to correct the facial asymmetry. But in practice, altering the direction of the smooth and subcutaneous layers independently provides very little real benefit. The horizontal skin rewrapping is essentially a process of trimming excess of skin after the vertical lifted smooth has already been secured. This effect can be sufficiently achieved in a deep plane surgery with only limited subcutaneous dissection near the pre-auricular area. Given that there is little justification for performing extensive subcutaneous dissection solely for this purpose. When comparing the relatively minor advantages of the dual plane approach, the advantages of the deep plane technique become apparent across nearly all aspects. This is especially important for East Asian patients. Compared to the Western patients, East Asians generally have heavier facial tissues and more angular facial structure. As a result, a significantly greater amount of lifting tension is required during facelift surgery. For this reason, the deep plane technique, which is withstand stronger tension, is particularly well suited for East Asian faces. Additionally, when patients with thick skin and heavy tissues undergo a dual plane type facelift, or retaining ligaments are not fully released from the smash dissection, the smash can gradually descend again over time due to gravity. Because of a substantial amount of skin has already been excited, this can be lead to a visible texture inconsistencies between the descended smash and the areas where the extensive subcutaneous dissection was performed. Once the discrepancy in tissue texture occurs, it is extremely difficult to correct, even with the revision surgery using the deep plane methods. By contrast, when the retaining ligaments are accurately and sufficiently released in a deep plane facelift, patients with heavier tissues can achieve results that are not only more effective but also significantly longer lasting. At the plane plastic surgery, we maintain the core principles of the deep plane concept while making subtle modifications based on each patient's facial structure and tissue characteristics. Another important advantage of deep plane approaches are particularly relevant for Korean patients. A large proportion of facelift patients already have a prior experience with various lifting procedures such as liposuction, energy-based contouring devices, fat-resorbing injections, or fat lifts. In this patient, the smash is often weakened or thinned. In such cases, a more extensive deep plane technique is necessary to elevate the tissue safely without tearing the compromised smash. This is essential for achieving reliable and predictable facelift results. One of the most critical elements of the deep plane technique is the location, length, and angle of the smash incision. This single line represents almost the only variable in deep plane surgery and is the most important technical factor. Although it may appear to be just one line, its position largely determines the outcome of the surgery. Each patient has different facial contours and varying boundaries between the firm and soft smash tissue. Identifying this line accurately is the key to successful deep plane facelift. I began applying the deep plane technique in at least around 2021. As you can see, even in patients more than 1 year post-surgery, the lifting effect remains well maintained and clearly visible. Next, these cases of patients who underwent dual plane facelift prior to 2021. While many of these results have remained stable, there are occasional cases where the smash was thin, making the surgery more technically demanding and time-consuming. When a procedure is technically smoother, surgical time can be reduced, and the consistently good outcomes can be achieved with higher reliability. For this reason, I believe that in coming years, the dual plane technique will likely to be regarded as an outdated method, much like the traditional coronal incision forehead lift of the past. In principle, there are no cases where the deep plane facelift is impossible. In fact, the more severe the smash damage due to prior procedure, the more necessary an extensive deep plane approach becomes. The only situation in which surgery may not be indicated is when a patient's previous surgical results are already exceptionally well maintained, leaving the little room for further improvement. There are claims that is in case of severe asymmetry, one side can be treated with a dual plane technique and the other with deep plane approach. Personally, I found this is difficult to justify. A facelift is not a procedure designed to correct intrinsic facial asymmetry. The internal framework and tissue thickness of the faces are left unchanged, while the outer tissues are repositioned and refined. To prevent worsening asymmetry, the lifting effect must be asymmetric on both sides. Applying different techniques can lead to differences in tissue texture, with one side showing separation between the mass and the skin. This can result in an illogical situation where the effect persists on only one side. Today, we review the two most representative facelift techniques currently in use. If you have further questions about today's topic, please feel free to leave a comment or contact the clinic directly. We will happily to provide a detailed explanations. Thank you for watching. I'm Dr. Chunyoung Park from the Plan Plastic Surgery. Thank you.